Welcome to Medical Rehab Matters. October is National Physical Therapy Month, and in this episode, we're discussing physical therapy. I'm Patricia Sullivan, Director of Communications for AMRPA, and your host for this episode. We'd like to thank podcast sponsor Bioventus for its support, and we'll begin after this short message.
Bioness, a Bioventus rehab company, develops medical technologies which include neuromodulation systems, robotic systems, and software-based therapy programs that provide functional and therapeutic benefits for individuals affected by central nervous system disorders and orthopedic injuries to help return patients to active lives. Learn more at bionessrehab.com.
So we have two guests today. Chris Lee, he is chair of the AMRPA Board of Directors and Vice President and Chief Operating Officer of Madonna Hospitals. And he is also a physical therapist. Hi, Chris.
Hi, Patricia. Thank you for having me today.
Thanks for being here. And our other guest is Derek Stepp, who is the Senior Director in the Certification Department at the American Physical Therapy Association, or APTA, we may call it. Hi, Derek.
Hi, Patricia. It's great to be here.
Thanks to both of you for being here. Chris, as I mentioned, you're the chair of the AMRPA Board of Directors, and you're a vice president and COO at Madonna Hospitals, but you started as a physical therapist. What drew you into physical therapy in the first place?
So I guess I've always been really interested in science. Really, as just a really young boy, I was interested in science, and medicine in particular interested me. And I had toyed with the idea of being a physician at one point in time, and just through a series of things that actually led me to physical therapy. And I've always been very happy that I made that choice.
Does that still influence your work at Madonna and at AMRPA?
I would say very much so. You know, I started at Madonna 30 years ago as a physical therapist. And when you have that opportunity to work on the floor, work with patients, work with all the other disciplines in the team, and then take on additional responsibilities over the years, it just gives people confidence that you understand what the issues are, that you do have a strong focus on patient care and quality, and that you know what you're doing. And many of the leaders in our facility have clinical backgrounds, and several of them have physical therapy backgrounds. And so I just think it gives you a unique perspective that's a patient-focused perspective. And I think that carries over a lot to some of the work that I do with AMRPA as well. There are several members of the board. I can think of 4 off the top of my head that are physical therapists. 3 of them are on our executive committee. And I think they bring that same type of patient-focused knowledge to the advocacy that we do as AMRPA.
And I do think it's important that we point out that physical therapy is one of the primary therapies that inpatient rehab facilities are supposed to be providing to patients, right? It's speech and language, occupational, physical therapy. I know there are other therapies, but physical therapy is really one of the biggest and most important things that our member hospitals provide.
Yeah, that's exactly right. For Medicare patients in a rehabilitation facility, CMS requires typically at least 3 hours a day, 5 days a week of PT/OT speech or orthotics and prosthetics. But it needs to come from actually at least 2 of those disciplines. And so PT is often a very large portion of the therapy delivered in rehabilitation settings, hospital-based settings.
Thank you for helping clarify that for us. Can you tell us a little bit about your education in this field, how you became a PT and then moved downward?
Yeah. You know, when I was in school in the late 80s and early 90s, the physical therapy educational track looked quite a bit different than it does now. It's really evolved over the years. But at the time I was going through school, I started with an Associate of Science in Health Sciences, then got a Bachelor's of Science in Anatomy and Physiology, and finally a Master's of Science in Physical Therapy. So today, the standard would really be the DPT, or the Doctorate of Physical Therapy.
We talked about this a little bit offline. How did your preparation as a physical therapist lay the groundwork to expand your scope of responsibility at Madonna and within AMRPA?
Well, historically, physical therapy is a field where a lot of therapists have run their own businesses. They've started their own clinics, maybe even a whole system of clinics in some cases. And so I think even back when I was going through school, physical therapy educational programs have long recognized that there needed to be a business component and needed to help instill that entrepreneurial spirit, and that we needed to be prepared for more than just patient treatment. And so most programs do involve some business classes and some other things like that will prepare you for doing more than just clinical care. But even if clinical care is your focus, it gives you, I think, just a much better understanding of the surrounding business, regardless of which setting you work in.
And how does that convert or apply to your work with AMRPA?
Well, a lot of what we do in AMRPA is advocacy work. And I certainly think that's something that I picked up going through physical therapy school, that we as therapists are supposed to be advocates for our patients and advocates for great care and advocates for our profession as well. And so that translates very well to the work we do at AMRPA in terms of being advocates for access to great care and advocates for what we do in medical rehabilitation. And in the role of chair and on the executive committee, we also do some of the things that every business does. We set strategic direction. We set budgets that will support that strategic direction. We look at the finances. And so I think having that well-rounded physical therapy education that covers all of those things is very, very helpful for any type of role where you have a scope that covers a wide range of responsibilities.
And I just like to point out that physical therapists, they help people walk. They help people do super basic things that most people take for granted. Can you tell us a little about Madonna's clinical ladder and the opportunities that it gives to PTs and other clinicians?
Yeah, you bet. Well, I've been talking a little bit about, my career path and how I think physical therapy prepared me to do more administrative roles. But I also think there needs to be a strong track for people that want to grow and develop clinically. The only way to progress should not be going into administration. And, in fact, we have some great clinicians that are a great fit working with patients, and that's what they want to do. And we want to support them in that rather than making them feel like they need to go into management to take a step up. And so we've developed a clinical ladder for physical therapists and other disciplines as well. But the ladder for physical therapist has a lot of things that would be more specific to therapy things that you can grow and develop in. And they really start at kind of a department level. And then we have a second level that people are going outside of their departments and they're working on different projects and things that are more at a system level or a hospital level. Then there are several points that you can gain on this ladder that are state involvement. For instance, I used to sit on the Nebraska chapter of the APTA board, and that type of thing would be a point at the state level. And then we also have activities that are at the national level. And as they gain points, they move up in levels. There's increased pay associated with each of those levels. And so it just gives them a track to develop and be rewarded for that development while focusing on really what they're doing clinically as physical therapists.
That sounds wonderful for them and for everybody involved. This is a good time for us to start talking about APTA's certification. Derek, that puts you on the spot. So what is the importance of the different certifications that APTA offers?
Well, in general, I will say the APTA special certification program was established in the early to mid 80s for the purpose of formally recognizing physical therapists with advanced clinical knowledge, skills, experiences in a particular specialty area of practice, and to help the consumer and the healthcare community in general identify these physical therapists who obviously have had a long history of engaging in a particular specialty areas or multiple specialty areas. But this was an opportunity for a program to be established to formally recognize those individuals and recognize them and then support their ongoing training and education in those particular specialty areas. So it's just a high commitment of those individuals, but also in many instances, they are looking to allow the opportunity to demonstrate their exceeded standards of beyond the entry level education and practice that they are engaged in early on in their careers, an opportunity to hone those skills moving forward and for career advancement. It is an opportunity to open doors to higher, what we found recently, higher income opportunities and career growth, professional recognition, as I mentioned, among their peers and patients. And also we found that it's an opportunity to instill a level of confidence and engagement to allow them to develop into leaders for the profession. We found that many of our board certified specialists early on, and that has continued historically, are often at the forefront of developments in research and practice and shaping the future of physical therapy, engagement in consultations and mentoring. So there's so many different levels of engagement and impact that the establishment of this program has had on the profession. And it's just been really exciting to have been a part of it for the past 16 years here within APTA.
That sounds fantastic. One of the things that AMRPA is very focused on is always improving patient care. So how do the certification programs help that or support that?
Well, I should mention, within APTA, high quality and safe patient care is the top priority for PTs regardless. Regardless of the advanced education or specialty coming out as an entry-level PT, that is a primary focus. However, getting a certification or multiple certifications, which we know to be the case, can enhance that expertise on a specific patient population or within a particular practice setting, really elevating those skills and knowledge. And what we have been observed through increasing research studies and through direct engagement is it's that complex patient case and cases that we've noted board certified specialists have had a particular impact on. So the referrals for some of those complex patient cases to our board certified clinical specialists has been key to continuing and elevating that patient care within particular specialty areas. And the collaborative nature of our board certified clinical specialists to realize when it is time to refer to another colleague or to consult with another colleague within another specialty area has been really key to advancing that specialty practice and specialty engagement. One of the most fascinating things that I've observed in my time has been some sponsored sessions that we've had dealing specifically with complex patient cases. And we would bring in specifically and purposely individuals with a different board certification specialty area. And we would introduce to them sometimes right during that session, a particular complex patient case and seeing each of the approaches of those board certified specialists to how they would initially review, assess that particular patient, and then consult with their colleague right there in the room and in front of other board certified specialists in the audience. And just seeing the different approaches and how the collaborative nature of their engagement really in the end just results in impacts for better patient care all around. So
that makes so much sense that people coming to a situation from a completely different perspective, or if not completely different, from a different perspective and looking at it through a different lens, it's going to come up with more options, more answers, more techniques that can help the patient. So how do these certifications help a PT's career growth?
What we found is, again, the ability to initially become board certified, but more importantly, what we do to support their ongoing maintenance on their continuing competence and professional development really has created a more well-rounded advanced practitioner from our perspective. That's what the intention and purpose of the program is, to allow them that opportunity to demonstrate that. But they provide access to the latest developments in research and patient care, because this is a big component to getting to that point in their specialty certification careers, but also one of the elements that's key to their ongoing education and training. It's something that we look for, require, and support as they move forward. We've noted that they develop a greater depth of knowledge and skills related to a particular area or scope of practice, practice setting. And in general, that's what led to our development of that maintenance of specialist certification process and programs.
How are these certifications earned and how are they maintained? The E requirements, the patient care hours, et cetera, the exam.
Sure. Well, first of all, I should mention that this process, the APTA Special Certification Program, governed by the American Board of Physical Therapy Specialties, is a strictly volunteer program. Obviously, securing licensure to practice does enable any physical therapist to practice. So this voluntary program, though, does allow for the opportunity, as I mentioned previously, to be recognized in a particular specialty area. But again, strictly voluntary. It's unrestricted. Individuals who do pursue board certification, it's a formal process, but those who do not are not prohibited from stating that, for example, they specialize in a particular area. They can't say that they're a board certified clinical specialist, but again, it doesn't prohibit their practice. Now, that being said, for those who are interested in pursuing board certification under ABPTS's purview, there are two pathways. The first is what we call our direct patient care hour pathway. And for those individuals, which is the vast majority of individuals at this point in time pursuing board certification, they have to secure a minimum of 2,000 hours of direct patient care within the specialty area they're pursuing. Those 2,000 hours need to have been acquired within the past 10 years. And of those 2,000 hours, 500 of which have to have been secured within the past 3 years. So that and demonstration of and submission of evidence of unrestricted license to practice in one or more states or U.S. territories is a minimum requirement across all of our 10 approved board certification specialty areas. Now, in addition to that minimum requirement, about half of our specialty areas do require additional requirements beyond those 2,000 direct patient care hours and the licensure. And in the vast majority of those, it's the submission of a case study or patient reports that demonstrate their ability to practice and that they have practice at a high level within that particular specialty area. So that is above and beyond that 2,000 hour requirement. Now, that's what we consider our option A, and you'll see that referenced quite a bit, option A pathway. We do have an option B pathway, which is becoming increasingly popular and now represents over 25% of our applicant pool, which is about 4,000 applicants a year. And that is individuals who are pursuing an ABPTRFE accredited residency program. And ABPTRFE is the accrediting body for the profession for residency and fellowship programs within physical therapy. So our option B is for individuals who are pursuing an accredited residency program in one of the approved specialty areas, again, having had to have achieved this within the past 10 years. But that's an automatic pathway. So the individuals who complete those programs, and actually we accept applicants from those who are actually currently engaged and enrolled in those programs, as long as they are expected to graduate and complete the program prior to the examination window. But again, that represents 25% of our current applicant pool. And there are definitely advantages for individuals who do have that possibility and opportunity to pursue an accredited residency program.
So you mentioned you have 10 different certification programs, and I'm not going to quiz you and ask you to list all of them off the top of your head right now, but I am hoping that you can identify which may be most useful for physical therapists who work in the inpatient medical rehab setting.
Well, and Chris would probably be in probably a much better position to answer that question than I, but I can state that while there are some that are prevalent, I think it could be appropriate for all 10 of our approved accredited specialty areas. Ones that would come foremost in mind would be those in neurology, cardiovascular and pulmonary, geriatrics. We have a wound management board certification specialty area, which would be key. But again, of our 10, there were only 2. And thinking about this question, and that may not be as prevalent, that being clinical electrophysiology and maybe our women's health board certification specialty areas. But then upon further reflection, it really would be dependent. I could think of situations where even those specialty areas in particular, it would be key to have a board certified and beneficial to have a board certified clinical specialist in those two particular specialty areas. And it really would be depending on the setting and be therapist specific, because, it's not a one size fit all for our board certified clinical specialists. They work in different practice settings, work with different patient populations. So I can't think of one of our board certification specialty areas where it wouldn't necessarily be depending on the situation, advantageous to have a board certified clinical specialist engaged in that opportunity. So,
and I can jump in on that a little bit. I'm remiss in stating that as I was talking about our clinical ladder, these APTA certifications are part of that clinical ladder. So these are some of the highest points you can get at that national level. We think these certifications really distinguish a clinician as being, right there at the top of their field, because as, Derek was outlining, it really is rigorous to get one of these certifications. And I agree that within inpatient rehabilitation, most of these certifications really are valuable. A lot of rehabilitation facilities have big cardiopulmonary programs, and that's one of the certifications. Certainly, we see a lot of geriatric patients, which is also a certification, but many facilities like Madonna, we have a dedicated pediatric unit, and we treat from 0 to 18 in that unit. And so pediatrics is another one that's very valuable. Orthopedics, we see a lot of major multiple trauma. Obviously, neurology for all the brain injury, spinal cord injury, and stroke that we treat. And, most of our members also have outpatient programming as well. And so that's where the sports certification might come in. And, I know that we have a therapist that specializes in women's health. So wound management's another one. So I've probably gone through most of the 10 at this point in time.
Yeah.
But we have a wound program. And even this might surprise some people, but one of the really developing areas in rehabilitation is cancer rehabilitation. And CARF now certifies cancer rehabilitation programs. I know we have a certified program on our Omaha clinic, and so the APTA's oncology certification fits very well there as well.
And people who have listened to Medical Rehab Matters from the beginning will remember, or they can go find I think it was our second episode was about cancer and inpatient medical rehab. And it was a really wonderful episode. And I encourage you to go back and listen to it if you haven't already. In the description of the podcast, I will include a link to the certification section of the APTA website so that anyone who has any interest in learning more about the certifications or deciding or trying to decide what they might want to get certified in can get that information directly.
Well, if I can, I'd just love to also mention 3 that are in development that the audience may not be aware of, but would be key to this discussion as well. And that is acute care. While they do have a residency pathway currently, they're actually very close to being recognized by ABPTS as an option and pathway for board certification as well. And then the other 2 are a very interesting one, which is primary care. It's an interesting new specialty area that's being considered that would obviously meet the expectations and needs from a broad audience of individuals and need in that area. And then finally, pain management is a new petition that's under consideration as well. So, and also the opportunity just to make mention that just in this past year, ABPTS purview has been expanded by the APTA House of Delegates to expand their purview to now oversee subspecialty board certification. So physical therapists who have gone that route in the subspecialty area have really only had the opportunity to be recognized through a fellowship education training. But now, for the first time, we're going to have the opportunity to recognize them formally through a similar process at a specialty level, at a subspecialty level. So it opens up a new wave of opportunities for physical therapists to be recognized, not only at the specialty area, but as they continue in their careers, become obviously a lot more subspecialized in their practice. So it's an opportunity for us to support and contribute to their ongoing education and training in those areas as well.
So I just wanted to give you both an opportunity. Do either of you have anything that you'd like to add?
Well, I just wanted to add some additional comments to something that Derek has referenced several times. He's talked about research, and I think that's another real strength of physical therapy education programs. If you go through a PT program, you will be involved in research, and that is another way that clinicians might develop over time in a different field that PTs might go into. Here at Madonna, we have the Madonna Research Institute that's led by Dr. Judy Burnfield, which the PTs listening might recognize that name as the co-author, along with Jacqueline Perry of the Blue Book, Gait Analysis. And she is a physical therapist. And I know that she's worked with a lot of our physical therapists here for them to be able to have some involvement in our research, even though they're primarily clinically focused. She's also been involved in providing some hybrid research clinical residencies for people that maybe want to do some of both or haven't decided which track they might want to pursue. So I think if you're interested in research, PT is a really good field to go into. And even if research is not what you think you're going to be doing long term, I do think it gives you the critical thinking skills to be able to do almost anything else.
And if I may, there were just a couple of items I just wanted to close the loop on. You had asked about how folks secure the certification, but I also wanted to make mention of what I think is almost the evolution of the program that really has elevated the board certification specialization process in general, and that's the maintenance of specialist certification process and program. I made reference to that multiple times during our discussions here, but once an individual becomes board certified, that's just step one in their journey. And we've had individuals who've been certified 30, sometimes approaching 40 years. And we recently, just within the past years, transitioned from what was a traditional recertification process and program, where really the certification, once achieved, is good for a 10-year period. But for the most part, historically, we hadn't had an ongoing conversation, check-in, engagement with our board certified specialists until maybe year 8 or 9, when it was about time for them to recertify. So ABPTS and the association supported our transition to what was becoming much more prevalent and has within healthcare professions in general, and that's a maintenance special certification. So while our certification is still good for a 10-year period, now we have requirements and check-ins at years 3, 6, and 9, where certified specialists have the opportunity to submit and demonstrate their ongoing continuing competence in the area of, obviously, their ongoing direct patient care, the hours engaged there, but also submit information and evidence on their professional development and professional standing and engagement through volunteer opportunities within their particular specialty areas. And then also the ability through the submission of a patient case and self-reflection, what we call a reflective portfolio. So they go through and we ask candidates to purposely reflect on at least one, if not multiple patient cases, and reflect how that engagement in that patient case has really impacted their ongoing practice. And then finally, I did want to make mention of a very exciting recent study that APTA put out, which is their APTA wage report. And they based this study on professions who are engaged with APTA throughout 2021 and 2022. And this was released in 2023. And what it showed was that certified specialists do earn roughly $6,000 more annually if they do have and maintain a board certification. And interestingly enough, those that are early in their careers, within that first, I believe it was a 3 or 5 year career, who pursue and achieve board certification, it's actually compounded. So it's even a higher impact on their salary. So I just want to make mention of that we've always heard this anecdotally from our board certified specialists, but this was a meaningful study that recently came out that really formally demonstrated that fact.
Well, it's good to know that if you're going to invest the time and effort into that, it has many different kinds of benefits for you, including financial. So I want to say thank you to both of you for taking your time and talking with us today about this. As I mentioned earlier, physical therapists, they're near and dear to my heart personally in my work with AMRPA. So I'm very excited that we finally have taken this opportunity to talk about physical therapy, physical therapists, and to celebrate National Physical Therapy Month, which is October every year. Thank you both so much for your time, and we will see everybody soon.
And Patricia, thank you for hosting.
Yes.
And then Derek, on behalf of AMRPA, thank you for being here on our podcast today.
It was my pleasure. Thanks so much for this opportunity.
Thank you both.
Bioness, a Bioventus rehab company, develops medical technologies to support recovery for people living with the effects of stroke, brain injury, MS, and other conditions. The Bioness portfolio of products includes functional electrical stimulation systems such as the L300 Go Drop foot system and the H200 wireless hand rehabilitation system. The Bioness Integrated Technology System, BITS, is a software-based therapy platform that uses an interactive touchscreen display to challenge, assess, and track vision, cognitive, motor, and balance deficiencies. The Vector, Gait, and Safety System is a ceiling-mounted robotic dynamic body weight support system designed to accelerate physical rehabilitation of patients with severe gait or balance impairment. Bioness combined portfolio helps drive efficiencies and improve patient outcomes for healthcare providers. Learn more at bionessrehab.com.
This has been Medical Rehab Matters, a podcast by the American Medical Rehabilitation Providers Association. Special thanks to Diamond sponsor Bioventus and Platinum sponsors PAM Health and Select Medical. To learn more about inpatient medical rehabilitation, visit us at amrpa.org.